You probably hear people claim to have OCD every day in casual conversation, or maybe even as a punchline to a joke. But when it comes down to one of the most well-known mental disorders, do you actually have it? And if you do, where did it come from? Let's talk about it. As you know, OCD stands for Obsessive Compulsive Disorder. The obsessive part relates to the thoughts that cause anxiety, and compulsive relates to the behaviors that are an attempt to reduce the anxiety. According to the Obsessive Compulsive Cognitions Working Group, an international group of well-known researchers, if you really have OCD, you would recognize one of these 6 thought patterns. 1. An inflated sense of responsibility. This is where a person believes that he or she can cause or prevent negative outcomes from happening by acting on compulsions. Number 2. Thought-action fusion. This is the belief that by simply thinking a bad thought, they can actually cause it to manifest. Number 3. Belief that he or she must have total control over his or her thoughts at all times. Number 4. Overreaction to a threat or severity of a situation. Number 5. A powerful drive to be perfect, or also known as perfectionism. And finally, number 6, an intolerance for uncertainty. If an hour or more of your day is spent acting on one of these 6 thought patterns, then you probably have OCD. Click this MagellanTV article link to learn more. Now, what causes OCD? For the most part, it remains a mystery, but scientists believe it's linked to our brain's ability to respond to the chemical serotonin. Studies have also shown that if a parent or sibling has OCD, there's about a 25% chance another family member will have it as well. In fact, they've concluded that genetics can make up as much as 65% of a person's risk for developing OCD. There's also another side to this coin. We just discussed nature, but what about nurture? Abuse, trauma, and major life changes all have a chance to trigger or worsen OCD. For example, if a person experienced a childhood trauma, they may believe that by doing a certain ritual, they could prevent it from happening again. But trauma isn't the only trigger. There's something called parental accommodation. Let's say a child is afraid of germs. It's hard to blame a parent for encouraging them to wash their hands. But encouragement of something that seems to be an ordinary, harmless activity can then end up leading to compulsions that develop into OCD. So we've talked about the symptoms and we've talked about the causes. But now what about treatment? Cognitive behavioral therapy is the most well-known treatment for OCD. It helps patients work through their compulsions through exposure. So let's say you're a germaphobe. Your therapist may make you touch a toilet seat, but then not wash your hands after. This therapy paired along with medications that address the serotonin receptor deficiencies typically leave the patient way better off than they were prior to the help. Thank you all for watching, and I hope you enjoyed this video. Make sure you subscribe and click the little bell so when we post more videos like this, you get to see it first. I'll see you next time.